Lovely. Well, good afternoon, everyone. It's morning in London, and I'm really pleased that you're all joining us. My name's Robin Ray. I'm a cardiologist at St. George's, and you're joined by Dr. Ahmed. Can you hear us now, Ed?
Yes, I can. Yes. Hello, good morning, everyone. Well, good afternoon, and welcome to this webinar. So thank you, Robin.
So both of us are going to take you through really the basics of MRCP Part 1, a little bit about Part 2, and hopefully take you through some tips and tricks that, having looked after and mentored many doctors who have been through this process, it can be quite daunting. And I think what you need to do is try and figure out the best way that you can navigate the MRCP sequence to kind of ultimately maximize your chances of passing. So, as you all know, the MRCP, when you get membership, it's recognized across the world. It's considered an entry level in the UK. So once you've done it, it gives you access to higher specialist training. So if you want to be a respiratory physician, a cardiologist, you must get MRCP first. And as you all know, it's an for international medical graduates. If you have that, it reflects really well on you, because it suggests that you're at a certain level and you're much more likely to be able to get a position in the UK if that's what you wish to do. And you have to remember the MRCP often is based on the UK medical curriculum, so it involves things like NICE guidelines. And so if you've passed that exam, it suggests that you're familiar with how we practice medicine in the UK. There's also the PLAB exemption for GMC registration, and MRCP is also recognized by other higher authorities throughout the world. And from my understanding now, in India, you're entitled to work as a physician in India also. So you're very familiar with this, hopefully. So the MRCP is in 3 parts. So there's part 1, written. There's part 2, which is written as well. We're going to focus mostly on part 1, but we will take you as time goes on through the others. And finally, MRCP PACES, which is clinical. And we've got various courses that tackle the first 2, and we're going to have things like communication courses that will help you get through PACES. And particularly for Indian doctors, this is probably the one that is the greatest hurdle, and you need particular mentoring like that, because if you go through the English system, you almost get teaching on a daily basis when you're in hospital from your senior doctors in how to pass PACES. So this is one of the key things, but we're going to focus, as I say, on the first 2. One thing I do want you to do, if you haven't done already, is check out the Royal College website. It's really important in terms of up-to-date information. You can actually sign up to receive email updates. So if things change, they will email you, particularly about application times for applying for exams. It gives you the structure of the exam, which I will go through as well today. It gives you the dates and also, unfortunately, the fees as well. Now, moving on to part 1. So this essentially is intended to match the progression of trainees undertaking what we call IMTs. This is an internal medical training, is how we call it in the UK. This has just changed. It used to be called something else called CMT, or core medical training. But essentially the way things work in the UK is that you have 2 years of foundation training called FY1, FY2, 2 years. And that's a mixture of all kinds of things, like a little bit of surgery, some medicine. It can be a mishmash of all kinds of stuff. But then you apply and you get into what we call internal medical training, which is 3 years of training. And during that process, you're ideally meant to get your MRCP. And that's part 1, part 2, and PACES. Most will try and get it in the first 2 years. So essentially in the first 4 years of you being a doctor, you'll hopefully have had your MRCP degree. But there is leeway. So in that 5th year, which we call IMT3, for those who don't get it, you've got an extra year potentially to pass the exam, and then you can go into specialist training. Now, you need a minimum of 12 months postgraduate experience. The assessment of knowledge is focused more, I guess, towards basic medical science, and it's stuff that you've done in undergraduate education. The purpose is to assess your knowledge of really common and important disorders, but importantly, clinical science. And there is an expectation of good knowledge, familiarity, and understanding of the UK national guidelines. So for us, this is the NICE guidelines. And it's particularly, as I said, relevant if you're working and studying abroad, because with the UK NICE guidelines, they may not necessarily be familiar to you, unlike UK graduates who'll be practicing the NICE guidelines almost on a daily basis. Now, if you look at the exam itself, it has changed recently. So unfortunately, it's a one-day exam, and it consists of 2 3-hour papers. So you usually have one in the morning and one in the afternoon, and each paper is 100 MCQs. Importantly now, it's the best of 5, which it can be quite tricky. So you'll have several choices which could be plausible. So you have a stem, and then if you read, let's say, A, it could actually be right. Then you read B, and you may think that B is actually right as well, but it's slightly better answer than A. You then read C, and that's an even better answer for the question. So you have to be really careful. And what's really important in the best of 5 is you have to read every single answer that's been proposed, and then you pick out the best of it. So it's a little bit tricky from that perspective, because there may be 2, there may be 3 answers which you think are right, but you have to choose the best. That's an important concept to get across. Unlike part 2, there are no images in this, so you'll just get text. Now, this is the rough breakdown that the Royal College give of the various categories of questions in part 1. And what I've done here is I've highlighted in red the big hitters. So you can see the biggest one is clinical sciences, 25 questions. That's a lot. That's 12.5% of your mark is from clinical sciences. And I'll go through that in the next slide. But there are others as well. So you've got cardiology, as you may expect, clinical pharmacology, endocrinology, gastroenterology, infectious diseases, neurology, along with these ones here, renal medicine, respiratory, and rheumatology. The reason I've given this slide is what you need to do is try and figure out what you're going to learn and how you're going to learn it. So let's say that you're very, very good at respiratory medicine. What I find often is that you have candidates who like to read more and more and answer questions more and more on the topics that they enjoy and like. And so they start reading even more about respiratory medicine and get better and better at that at the expense of others which they don't like. So what is important is that you focus on, let's say, clinical sciences. You focus on geriatric medicine, which is a relatively new one, so things like frailty, dementia, questions like that. Think about ophthalmology. It is only 4 marks, but these are often quite easy marks to get. So if you don't read it, you don't understand it, you'll lose those 4 marks. And you've got palliative medicine and psychiatry. It's really quite difficult because there's a lot to get through here, but in some way you need to try and figure out how not to miss all of these groups, but potentially try and put a little bit more emphasis on, as I say, these big hitters, which have the 14 questions or the 25 questions. But be mindful that things like ophthalmology or potentially geriatric medicine do have significant marks, and you do need to tackle these as well, but perhaps don't spend as much time. And certainly if you're very good at a particular topic, don't spend more time on that. Spend time on your weakest categories. So as I mentioned, there's clinical sciences, 25 questions. That's a lot of marks. And if you look at the breakdown, you've got various categories here. So the big one here, as you can see, is statistics, epidemiology, evidence-based medicine. these questions, to be honest, tend to be relatively easy. And so it really is well worth spending a little bit of time reading about these topics, trying to answer MCQs on these topics, because as I say, it's worth 5 marks. The other one is immunology. And again, these questions are relatively easy to answer, so try and do the work and read up on it. Genetics is relatively easy as well. The one I pick out that maybe not is clinical anatomy. So we do need to know clinical anatomy, but you have to learn quite a lot, and it's only worth 3 marks. And it's up to you how much time you spend on it. And certainly if you look at cell molecular and membrane biology, unless you want to be an academic, it's only worth 2 marks. So again, you need to try and figure out yourself how much time you spend on all of these different categories. So this is taken from the RCP website yesterday. You can see that the next exam date is the 18th of May. It's not long, and some of you may already have applied. I'm not quite sure if this is correct, but it looks like the deadline is tomorrow. And then you've got another one in August and another one in November. Seems unfair, but it looks like international students have to pay a little bit more than UK students. I'm not really sure why that's the case, but it's an expensive exam, and for that reason, you do want to really concentrate on trying to work hard, make sure that you know your stuff. So ideally, you pass first time, and that way you'll also reduce the amount that you're paying. So this is a bit on part 2. We'll go into this a bit detail in other seminars, but I thought it will be useful just so that you don't necessarily revise for part 2 at the same time as part 1, although there is some overlap in terms of your learning. Part 1, as I said, is a little bit more towards the basic science. Part 2 kind of builds on the knowledge that's been assessed in part 1, and it tests the acquisition of medical knowledge, skills, but also your behavior, how you manage patients. The exam will test your ability to apply clinical understanding, how to use national guidelines. So it's generally the UK NICE guidelines, and make clinical judgments, take responsibility, prioritizing diagnostic problem lists, planning investigations, trying to sort out plans. And that may be an immediate management, it may be long-term management, and also looking at prognosis. So part 2, as I said, is the acquisition of medical knowledge, skills, but also behavior. You'll often get a clinical scenario. So it's often, candidates I find it a much more fun, if you could call it a fun paper to learn for, because a lot of the patients you'll have seen already, and they'll say there's a 65-year-old man who you see who comes admitted with shortness of breath, and you'll be able to remember patients that you've seen when you're on take or when you're in hospital, and it helps in terms of your learning, where you're bringing the books with the MCQs and your clinical scenarios and your own kind of growing clinical experience. And that's the way you have to learn. Without that kind of combination, it won't cement in your brain, and you're not going to be able to remember it for number 1, the exams, but then number 2, when you truly see patients as you progress after MRCP. There are lots of investigations as well. I'll show you one example of a question like this, because there may be quite a lot to get through and read, and what you need to do is try and figure out in the question, what are the important bits? They may give you a whole load of investigations, but which ones are the important ones that are relevant to try and answer that question? And unlike part 1, part 2, you can have images. So you can have histology slides, chest x-rays, CTs, MRIs, echocardiograms. You may have pictures of skin. So make sure you try and look at these and try and learn these. If you're in hospital and you've got a patient that comes in and they have a CT scan or an MRI scan, for instance, after a stroke, go and have a look at the images, because that will again cement the stuff in your mind. You'll be able to remember it. So when you come to the exam, you'll remember that patient that you saw a few months ago who had a stroke, and you'll be able to, it'll make it easier for you to diagnose and answer the question correctly. The breakdown of questions in part 2 is slightly different. As I mentioned, it's still 200 questions. But again, I've highlighted the ones where there are slightly more questions in red, and it's similar, I guess, to part one. So you've got, cardiology, pharmacology, endocrinology, gastroenterology, infectious diseases, neurology, and you've got renal and respiratory medicine. So perhaps you'd want to spend a little bit more time on those. But remember, there are others as well that you mustn't miss. So dermatology, and they often put pictures there, is 9 marks. And people often tend to do slightly worse in dermatology. So that is a differentiator. So if you can get 7, 8, or 9 marks, then you're much more likely to do better than your other colleagues who are doing the exam. And geriatric medicine is there again. So don't forget that. And there's obviously overlap from part 1. So it's really worth trying to do it. Ophthalmology is only 3, but they tend to be quite easy questions. And so you don't really want to lose those marks, because if they're easy questions and you do badly on them and others do better, then that differentiates you. And that's part of the marking in terms of how it's done. It's all kind of standardized, and it looks at how you do compared to your colleagues who've taken the exam with you, but other diets of the exam as well. These are the dates that I picked from the website yesterday as well. So this probably is less relevance to you. So you've got 1st of June, September and December. And again, you've got that differentiator. So it is an expensive exam. So you do want to try, if possible, to pass it first time. So this is almost coming to the end of my presentation. I thought I'd give you some of my tips and tricks as well. I wouldn't really worry about passing or failing. You will get a mark, but generally, if you're going to apply for jobs, all you have to say is that you've got the MRCP. So the actual mark itself doesn't necessarily matter as much. You need to pass the exam. Importantly, there's no negative marking. And it's unfortunate, but every year there are candidates who don't answer all the questions. And it's a really, really simple tip, and that's just answer all the questions. Don't leave a gap. You've got a 20% chance just by luck if you fill it out. But if you can narrow it down to, let's say, 2, that chance goes up to 50%. So it's very obvious, but we get lots of candidates who miss it. And in part, it's because they just don't have time to finish it. And they think, I'll answer it, I'll go back and answer it. And they run out of time and they don't fill it out. So time management as well is really important during this.
Robin, can I just make a point on that pass or fail comment that you very well made on there?
Yeah.
And I think as people coming from outside UK, I think you put it very well there that you'll get your mark. So the key is to focus on the mark that you've achieved rather than whether you've passed or failed. But actually, people coming from the subcontinent, we are quite hung up about these things, and having failed is taken as a marker of something that is not very good. So the key thing is to actually focus on where you have missed out, because it will give you a breakdown of how much marks you have scored in which subject. And I think rather than focusing on the fact that, oh, I couldn't make it this time, I would focus on those subjects where I haven't done very well and try and build up on it. And it won't matter, 5-10 years down the line, nobody's going to ask you how many times you took to pass your MRCPs. But what does matter is that you've passed it and then, you've become a consultant. Sorry, carry on. Yeah.
Absolutely. And so what is actually quite important is time management in the exam. And the reason I mention it now is that you really need to practice it now as well. So if I give you an idea, you've got 3 hours, haven't you? So that's 180 minutes to answer 100 questions. So for instance, if you try and spend 1.5 minutes per question, that gives you a total of 150 minutes that you've answered the questions, and it leaves you 30 minutes to go back and try and look at all those gaps that you've done that you can fill out. And also all those questions that you're not too sure about. You may have narrowed it down to 2 or 3 parts, and then you need to try and pick one. So please don't try and run out of time, because you lose a lot of marks that way. And those marks are critical because it's kind of very narrowly marked. and it's kind of like on a normal distribution. If you lose maybe 3 or 4 marks, it could be the difference between a pass and fail. So every mark actually is really quite important. But the reason I mention it now is that I want you to try and practice doing papers. And I can probably go to the end here. One of the biggest reasons that people pass, if you look at them, is they do lots and lots of questions. The key to passing both of the written papers in MRCP is doing lots and lots of MCQs. And I'm talking thousands. You need to do a minimum of probably 3,000, if not 4,000. And the more questions you do, the more likely you are to pass. So, of course, use books. I use this one by Phil Calra for the MRCP. I've recently been told about this book as well, Step Up MRCP. I've not used or read that myself. But my big tip is actually to pick one book. Don't pick more than one. I made this mistake myself when I was a medical student, and I thought, oh, I'll get 3 or 4 books and I'll take the best bits. I didn't want to miss any important information from one book. But the problem with that is that you waste time. And you have to remember, you're all busy clinicians, you're working full long hours. And on top of that, you have to revise for the exams. So it goes back to time management. Time management is so crucial. So when you're doing and revising for the exam, let's say you may have 3 weeks, you may have 3 months. So you need to try and figure out how you're going to revise in the time that you have for the exam. So let's say you've got 3 months. If let's say you do 50 to 100 questions, MCQ questions every single day for 3 months, that'll be between 4,500 to 9,000 questions that you do. The likelihood is that you will pass because you've been through so much. And one of the beauties about questions is that it stimulates different parts of your brain. So you do the question. If you get it right, then you feel good in yourself. You think, oh, I got it right. And you remember that. If you do a question, you get it wrong, you think, oh dear, I got it wrong. Why did I get it wrong? You then go to one of the books, find out why, or you read the spiel, why you've got it wrong. And again, it goes into your brain so that when you come across that again, you remember, oh, I got that wrong last week. I'm going to get it right this week. I know why the answer is right. And so by virtue of doing questions, you actually will end up actually doing better in the MRCP exam. So you need that balance between obviously learning from books, but please don't spend a huge amount of time on books because that is not the way. What you need to do is practice, practice, practice MCQ technique. And with that, you'll also go with time management. So if you can, let's say, go for 1.5 minutes per question on average, it means that you won't run out of time during the exam. And you'll have time to go back to the difficult questions to try and get those right and try and work out what the clues are in the question to try and get it right.
Yeah, Robin, there are a couple of questions here. When Dr. Gargi has asked, how tough is MRCP for person who is practicing pulmonary medicine for last 10 years? Without theoretical touch in overall internal medicine?
Yeah, it's a good question. I think the further you get from medical school, the easier MRCP Part 2 becomes, but the harder Part 1 becomes. And that's because a lot of it is clinical science, which you would have learnt already in medical school. And as time goes on, you tend to forget all of those things. You don't use it, and so it disappears. So it is much more likely that you'll have to put more effort than other people taking the Part 1. So you'll have to just go, there are books which you need to read probably a little bit more. So the one I mentioned a minute ago, so these are some books you probably need to spend a little bit, counterintuitive to what I said before. You yourself will probably have to spend a little bit more time going through some of the information and knowledge before you go onto the questions. And rather than, let's say, going for the next exam, probably wait to don't go for this next exam, go for the exam after. So it gives you a bit more time.
And there are another question that somebody is sending in my chat box, that is, I'm planning to give exam on September and how I am prepared myself for this exam. So he has only 6 months time. So anything, your suggestion, how he will prepare in this 6 months?
So 6 months is a very long time. So, you know, if you know, you've got more than enough time to learn everything that you need to pass. But what you need to do is be very time efficient. So if you can, let's say, average 50, maybe 100 MCQs daily. For you, if it's 6 months, I'd only do maybe 50 MCQs on a daily basis and back that up with one particular book, one of these. And you can, you know, Farz Academy is developing a website that's going to come in place quite soon. They have thousands of MCQs, and there's this modular scheme where you can go through videos where they give you the basic information. But what you need to do is do lots and lots of MCQs. Be a bit careful because, as I say, 6 months is a long time, and you may start off learning quite well for the first few weeks, maybe for the first couple of months, but then you may get a little bit tired and fed up and think, I can't be bothered doing this. I've got another 4 months to go. So what you need to do is probably gradually ramp up how much you're doing. So start off with some books and go through the main concepts in the first month. In the second month, maybe start to do some MCQs to test your knowledge. In month 3, you may want to read a bit more of the books and then back that up with MCQs. And in the last 3 months, you want to do more MCQs and practice your time management so you can scan through a question quickly and answer it appropriately. The problem with a question like this is that you have to personalize it. Everyone is different and everyone has different learning techniques. There are some people who will get up in the morning at 4 o'clock or 5 o'clock and do 2 or 3 hours. There are other people who are what we call owls rather than larks, and they'll come back from work when they're tired and they'll try and do hours at night. I used to be an owl. I used to, you know, work at night, and I thought it was really good. But probably, I don't know how long ago, for my last exam, I switched and I started to get up early and just get it done in the morning when it's quiet, there's no disturbance, and you've got the whole day to look forward to. And I learnt for a couple of hours, and then I went to work. And when you go to work, you're actually quite happy because you can think, oh, I've done my 100 MCQs, I've done my learning, and then you can relax. You're not worrying about getting back from home. And also try and use every opportunity to learn. So I know that, you know, there are lots of different companies, but Farz has an app which will be on the Apple Store and Google Play. And the idea is that if you're going to work in the morning and it takes you 30 minutes or 60 minutes on the bus or train, then you practice your MCQs on the phone. And then when you come back, again, you practice your MCQs on the phone. And then if you do half an hour on the way to work, half an hour on the way back, that's an hour that you've done already. And it's an hour that you don't have to do when you're at home. You can spend time with friends and family, and it's getting that work-life balance appropriate. But as I say, going back to you, 6 months is a long time, and you need to try and figure out how you're going to do it appropriately. Because what I find is, for people who start too early, they do get fatigue, and then towards the end, they just get fed up. So you need to have some way of kind of gradually building up in the way that I said, but obviously personalize it to yourself because everyone's a little bit different. Hope that answers your question.
Thank you. You carry on.
This is all fairly basic stuff. As doctors, you've done exams many times so far, and this is all fairly obvious stuff. So obviously check the location of your exam. You should print out a copy of your admission document. They do have ID similar to all exams. It's up to you what food and drink you want to bring. It is a 3-hour exam, so it's quite tiring. There are some centres that don't allow you to bring that, but certainly you should bring water. Water is really important to keep yourself rehydrated, and it helps brain function. And there are various schools of thought about having food and what kind of food. It's up to you and what works for you. People say you probably shouldn't have sugar and sweets. Other people just munch on sweets during the whole exam. And other people, you know, may want to have fruit and things like that. But try and think about food and drink. Don't forget about that. The exam centre will give you all your stationery supplies, so no need to bring anything like that. So don't bring calculators, don't bring pencils, because you won't be able to use it. And it always happens. So in my hospital last year, there were 2 candidates that arrived late to the exam, which is, I mean, it's ludicrous. Arrive early, 30 minutes early. I often arrive even earlier for all my exams, because it just means that the whole day is less stressful. You want to have a good sleep the day before, and then you want to make your way to the centre early. If it's far away, then maybe stay in a hotel the night before, so that you can get up, have a nice breakfast, and then, you know, walk or go to the centre without worrying or stressing, because then that leads to problems as well. I was going to take you through 2 questions very quickly, and then I'll hand you over to Dr. Ahmed. So these are taken again from the Royal College. This is the kind of question that you may get. And if you look, there's a lot of text to read through. And remember my tip of roughly 1.5 minutes per question. You need to read through that. You need to be able to digest the results. And then you need to try and figure out which of these questions, which of these answers is correct. There's quite a lot to do in 1.5 minutes. And remember, you're going to have to do this again and again and again, 100 times over a period of 3 hours. And so this is why you need to practice. And the big tip is probably don't read books, but do practice MCQs and get used to scanning questions. So, you know, 3-month history of legs, malaise, weight loss, diabetes, hypertension for 18 years. You're on gliclazide, ramipril, atorvastatin, blood pressure's high. There's tenderness over spine and legs. So you're trying to pick out the important things. Then scan through the blood results, and then you'll be able to answer the question. This is also an interesting thing. So one of my other tips as well is to often read questions backwards. Now, this may seem a little bit odd, but trust me, reading this is utterly useless, because if you read the question itself, what laboratory finding, this is directly from the RCP website as well, and has been used previously. What laboratory finding would best support a diagnosis of Wilson's disease? So the question is obvious, and you can answer it there. You don't actually need to read any of that at all. And so if you have a clinical scenario which is very, very long, then one of my tips as well is to read the question first, to try and figure out what they're asking you. Then, so read that, number 1. Then you may want to do is read the question. And then number 3, you then may want to look at the answers. You may instead, depending on the question, look at the question first, look at the answers, and then number 3, actually read the clinical scenarios. There are different ways to answer the question that speeds up your time. But for this one in particular, and these questions come up, this is a badly worded question and it shouldn't be here, but they do come up, unfortunately. But this will save you reading all of this, and it'll save you half a minute, which will be more time to answer perhaps a more difficult question. So in summary, I can't lie to you that revising for the MRCP is not easy. If you have time, then that's fantastic, like the doctor that's got 6 months. But you know, you can actually revise for the exam in 3 weeks and pass as well. So try and figure out how much time you have, split that time, and then divide it amongst books, MCQs, and practice, practice, practice. It does involve a lot of reading, a lot of learning, but all of this is actually quite relevant to being a doctor. So it's actually a really, really nice practical exam to get involved with. But as I say, be clever with how you do your work, try and be efficient, take every opportunity to revise for the exam. And we certainly will help you as much as we can on your way, hopefully, to success. As I mentioned, there's going to be an app available shortly, which has access to a large bank of thousands of MCQ questions, which are very similar to those that you'll see in the exam. And the more practice you do, the more likely you are to be successful. Okay, so thank you. I'm going to hand over now to Dr. Ahmed. Let me see if I can stop sharing.
Yeah. So, Robin, there are another 2 questions for this session. One is, I'm intern. Do I give part 1 during my internship? So what
I think
MRCP curriculum said?
I think we'll probably take all the questions at the end, because let Dr. Ahmed finish off, and then
Okay.
we'll do all the questions at the end. That would be easier.
Okay. Okay.
Yeah, thank you, Robin.
Sorry
That
for
was
the
very-
interference. Thank you.
Yeah, thanks, Robin. That was a very comprehensive sort of, introduction to MRCP, and I don't think I've got anything to sort of add on to that. I can probably present my perspective from being an international sort of medical graduate who came to the UK some years ago. And MRCP does pose a challenge to us who have graduated from abroad, because the whole setup of the exam is single best answer, multiple choice questions. I'm not entirely sure how the medical curriculum is running currently in India, but I know that a lot of focus is on more, detailed, question and answers rather than using MCQs. So I think the key is to basically, learn how to answer multiple choice questions. And I think Robin went through the steps of, trying to learn how to do that. I mean, the best way you can learn to do that is to just practice, practice, and practice. I know that some of you are asking about, whether you need to read any books, and I completely agree with Robin that reading too many books is not going to help you in this exam. And I think you should focus on one or two books. Philip Calder's book is very good. And of course, when the Farz Academy app will come out, and that will be a very good, rich resource, for question and answers. So if you use the app that will come out in the very near future, then that app will be a sort of a setting stone for your preparation for the MRCP. And of course, getting into the modular course of the MRCP, where we have prepared lots of presentations for every specialty, that comes in the exam. And the modular course has been prepared in such a way that you probably would not have to go back to reading the books in details, and they will have enough information for you to actually try and come up to terms with answering the MCQs in your exams. So practicing is the key to getting through the exam. I know that one person asked about, somebody who's doing pulmonary medicine for the last 10 years and how difficult it would be. I mean, there is no doubt that it is going to be slightly, more challenging to take the exam after so many years of having done what we call practical medicine. Part one will be particularly challenging because that is a very much like a knowledge-based exam and testing your knowledge. And it's almost like, if you want to, say, for example, drive a car, then you have to learn the theoretical aspects of, what is a steering wheel, how to use a brake, etc. But then part two is more like taking the practical exam. When you're on the road, then you're actually facing the practicality of things. And then, trying to drive the car, when you're seeing things in a different perspective. So I think part one would be particularly challenging in that situation because, you may have to go back to the basics and revise. And of course, as we've said, do more and more questions just to, get yourself better at answering the MCQs. I know that the Farz Academy is going to hopefully start the modular course very soon, and that I personally think that would be a stepping stone for for you to get prepared for your exams. Somebody has asked about which theory books you suggest: Harrison, Davidson, Kumar, Clark, Sheshel, or Oxford. I mean, Kumar and Clark is good. Oxford Handbook of Clinical Medicine, you will always have. So, for example, if you've done your MRCP exam and you are practicing medicine in the UK, then, it is expected that you will always refer yourself to the Oxford Handbook of Clinical Medicine while you are, working here as well. So it's an important thing to just touch base with that at some point.
I find that quite funny, Noad. Kumar and Clark is a great book. I probably wouldn't recommend it.
Okay.
I've written the cardiology chapter in Kumar and Clark.
Okay.
But if you read the cardiology chapter, it's very, very long. It'll take you a long time. And it depends on how much time you have. So if you've got 6 months, then fantastic, read Kumar and Clark. It'll be a great book for it. But if you've got 3 weeks or 1 month or 3 months, then, you know, Kumar and Clark now is massive. PDF file that I've got for it is huge, and it's got a huge amount of information. I think both of us said that you need to focus on MCQs, MCQs, and reading big books is really not the way forward. Harrison's 100% no. I know a lot of Indian graduates read Harrison's because they think, oh, I need to read as much as possible. But the problem is you'll waste time reading that. You'll be fantastic at regurgitating information. But the whole point about MRCP is it's a practical exam, and it's how you get your knowledge, but put it into practice and answer an MCQ. And reading Harrison's is not going to help. And I'd love that you read Kumar and Clark, given that I've been involved in the book. But again, it's a really, really big book. So maybe
yes, it is. Yeah.
Pick a small book.
Sorry, can we take the questions now, Robin? Is that okay?
Yeah, absolutely.
Yeah. So whoever is coordinating, you can, you know, ask them to ask questions directly to the panel, or
yeah, I think we can start off.
Student, you can unmute yourself and you can ask your question to our expert.
Yeah, I think we'll probably go by the chat box, the questions that we already have. And if anyone wants to ask any questions, you're more than welcome, really. So one of the candidates have mentioned, do we need past tests, past medication along with Farz Academy 6 months course? And which one is best?
I think what I said before holds. So the more questions you do, the better. I know that past medicine questions are actually quite easy. I don't want to say anything for or against other courses. I think that's unfair. But the feedback I've got from doctors who I've mentored over the last few years is that the past medicine questions are quite easy and are not necessarily analogous to the actual exam itself. So they go into the exam and it seems to be a lot harder. So I mean, that's my kind of the personal feedback that I've got. But what holds true is the more questions you do, the better.
Yeah, I completely agree. I think you know, it's more about practice. I mean, and learning. You know, I mean, if you've answered a single best answer question and you get it wrong, then you try and work out, you know, where did I get it wrong? I mean, the way I see it is that if you have 5 choices, 3 choices are, you know, can be wrong, but there are 2 choices from which you have to really, you know, understand which one can I pick. And I think just reviewing the reason why you got wrong that question is important. And you know, just practicing would be the best thing forward. And I would not rely too much on books.
Okay.
I think there is a thank you both. There's one more question for 𝑚𝑰𝑔𝐺𝑗. This is probably a common question what we normally come across. So I'm planning to do an exam in August. It's a very short time left. So please give me a study plan. I think we already been discussed, but anything to highlight on?
You've got 4 months, so you've got lots of time, to be honest. Don't worry about that. You know, most people here maybe spend about 3 months and will pass. So 4 months is more than enough. But again, I think just personalize it to that time and try and ramp it up. The other thing I didn't mention is think about leave as well. Think about holidays and think about trying to take some time off just before the exam. So it's not always possible, but if you can take off 5 days or a week before the exam, then that's quite useful as well. And you may have notes, or you may want to go through MCQs in that week before and focus on particularly topics that you're not good at. So at the beginning, try and do everything. And then when you get the feedback in terms of, as Nawad is saying, you need to really look at the areas that you're doing badly and your weaknesses. And then towards the end of the time, in that last month, focus on those weakest areas. That's more likely to get you passing the exam. And in fact, you may end up excelling rather than just passing. If you have good, the technique is the most important, because to be honest, you're all doctors. Everyone's got a certain level. No one's, to be honest, that much better than anyone else. It's just how you learn. The people who do a little bit every day, it's like the analogy of the tortoise and the hare. Doing a little bit every day really helps. And as I say, just do, if 50 MCQs is actually quite a lot. Do 50 MCQs every single day for 3 months. 3 months is 90 days. 90 times 50 is 4,500. So if you do 50 a day, and make sure you do maybe 25 in the morning on the way to work, 25 on the way back to work, back from work, that's 4,500 questions you've done in 3 months. And if you can do a little bit more on the weekends, or maybe have a Sunday off, it's up to you how you do it. But you need to work around your schedules and your family and your friends, because it's having that work-life balance as well. Don't make sure that this is a huge weight you've got to pass. You need to kind of enjoy the process. Because if you enjoy it, then you're more likely to remember the stuff. And then when you go to part 2, there is a lot of overlap between the two. And then you'll remember it for when you're a doctor and you pass the MRCP, because a lot of this comes back, to be honest. And it's actually a very good exam. It's a practical exam that makes you a better doctor long term. It's not just to say, oh, you've got the MRCP degree. It's helpful for your future. So 4 months, I wouldn't worry. You've got lots of time. Just do lots of MCQs. Maybe try and do some reading now. Focus on the topics that you're not too sure about. If there is a modular scheme, that'll be quite good now to go through, to try and kind of get your knowledge on board. And then as you're getting nearer the exam, loads and loads of MCQs, and gradually ramp it up, so that towards the end you're doing lots and lots and lots, and you're focusing on your weakness. But as I say, try and take a week off before, if at all possible, and that will really help you. It'll make you less stressful. What you don't want is, we all do busy jobs, and what you don't want is you go in at 8 o'clock, you come back at 7 o'clock, and then you have to revise, and this is a week before the exam. So try and plan ahead and take some time off, and maybe try and sort out your holidays for the next 6 months. So you take a week every now and again, and during that week you either partly relax but also revise. But make sure you have some time off just before the exam, because that will be very helpful. As I say, you don't want a busy job with on-calls at night, on-calls at weekends, and then you're having to take the exam. And it may not be possible to swap out of those things. I remember when I took my MRCP Part 1, I was kind of doing nights on call on the weekend, and it wasn't ideal. And I would have much preferred to have had that time off and either relaxed or, concentrated on questions that I wasn't sure about.
Yeah, I think, thanks, Robin. I think that on a similar line, I think Dr. Rashna has asked a pretty much similar questions. So how to manage time if planning for MRCP 1 in August with residency, how much time should be given, and how much questions for this has all been answered already. So Dr. Ahmed, anything else, anything you want to add?
Yeah, I mean, every person is different, isn't it? I mean, we all have different ways of learning. Some people learn by just reading. Some people will learn, by visualization, like looking at slides, writing down things, having memory cards, as, some people use here in the UK, which I came to know only when my daughter, started taking her exams in school. So, your exams are in August, you're doing residency. So you have to have a look at what your rota is like, how often you're at work, when are you off? And I know that sometimes residency in India can be quite onerous. So if it is too busy, then I would not try and do any practice during my busy week, because you will be tired and you will not get anything in. And particularly look for occasions when your rota is slightly less onerous, days when you're off. And you don't want to spend all the time just studying, because that's not also going to help. You need time with your family, with your friends, and also you have to then work out that time where you are really concentrating on just looking through your questions and practicing them. There are some questions which, as I said, if you are getting it wrong all the time, then it would be a good idea to write it down in a notebook or something to say that this is the one which I'm getting wrong quite a few times. So let me just have a read around the subject. And that is when you pick up a textbook like, Philip Culver, and just have a slight read around that subject, or Oxford Handbook, to see why you're getting that question wrong. So yes, don't study when you're tired, definitely. Try and find time, say on a weekend when you're off, or when you're not meeting family and friends. But plan ahead in terms of, as Robin was saying, how many questions you need to do per day, so that you are well prepared in 6 months' time, to take this exam. But different people will have different ways of learning, you see. So although I'm saying this to you, you may actually find your own way of doing things in the, practicing, etc., just to prepare for the exam. But these are the basic sort of, fundamentals that you need to probably adhere to.
I think one of the important points is to try and make sure that you reflect back in terms of how much you've done. So if you're looking at questions, do try and count how many you've done, so that as you build up, you'll get that sense of achievement. Oh, I've done 1,000 questions so far. I've still got another 2,000 or 3,000 to go. If, let's say, today you've only done 20 questions, then you need to be very mindful and say, well, for the next 6 days, I'm going to do an extra 5 questions every single day to catch up. And there may be days that, there may be days where you don't do any revision at all. Or you may say that every single Friday or every single Sunday, I'm not going to do any revision. But, have that break as well from all the revision, because otherwise the continuous onslaught of trying to learn is not very, very good for the brain. But do MCQs, that's the key thing. MCQs trigger things in your brain, and it helps with memory. And then if you get something wrong, then try and read about that now, but then read about it again in a week, and then read about it again in a month. And that way, after a month, you won't forget it, because you've had 3 points where you've remembered the same thing, that difficult concept that you're not sure about.
Yeah, thanks, Robin. I think Dr. Pravini has asked, I think she's unfortunately got 510 the last MRCP. That was her first attempt. But now he is registered for the next MRCP in May. So any suggestion and tips for her? Thank you.
Yeah, I mean, I think Nawad has answered this really nicely. So you've got 6 weeks, haven't you, till the exam, and you'll have a breakdown of your marks and which specialities you've done well in, which specialities you've not done well in. Okay. If you've done well in those specialities, as Nawad has said, you don't need to necessarily spend as much time in those particular areas, to try and focus much more on, it'd be nice to see your breakdown in a way, or if you can tell us your breakdown, but the areas where you've done not particularly well in, particularly if it's a big hitter. So let's say you did really badly in cardiology, then you should spend a great deal of time on cardiology, but then spend less time, but also do all the other specialities, but spend more time on the ones that you've done worse on. To be honest, it tends to be clinical sciences. That's the one that everyone doesn't revise on. And so if you can focus on the clinical sciences, I gave that breakdown of statistics, epidemiology, immunology, potentially clinical anatomy. If you can focus on those, if that's the area that you've done badly in, then maybe get a part 1 book in clinical sciences. I can't, is it, there's one by Easterbrook. I can't remember her first name, but maybe get a book like that and then just read through it. you can read that book in a week if you want to. Just, you know, flick through it and try and learn, and that will give you the grounding to do well in clinical sciences if that's the particular section. But I think, as Nawad has said, go through the mark scheme, see where you've done not as well, and focus on those areas in particular. Don't spend more time on the areas that you've done well on, and that's the mistake that a lot of people make for some reason.
Yeah, I completely agree. I think you know, you just get very comfortable with areas that you are good in, and you just tend to keep your attention to those areas. But actually, having had the distribution of marks helps you try and focus on areas where you have to improve.
Yeah, thank you very much. I think we haven't got any more questions on the text. But if anyone wants to ask any question, just unmute yourself and please go ahead. So this is probably one of the best opportunities you can have. You can have very trained faculty members, and you can discuss your doubts or just to clarify many things.
First of all, I would like to thank the organizers and the presenters for the excellent presentation. I am a senior registrar in hemato-oncology working at Sri Lanka. I am planning to do the exam in August. I'm the one who asked the question, and I got a very nice explanation to how to plan my work. I would like to thank for that. And also, I have one question, sir. I studied oncology only for 4 years and the hematology. So I am thorough with the hematology, oncology, and palliative care, but I am not now familiar with the medicine topics. So I want to know how to focus on those things. I got very high marks in hematology sections and I doing the MCQs, but I have not touched the that medicine part, which is the vast majority. I want to get some clues to how to excel on those things as well. Thank you so much.
Yeah. So, I mean, do you want me to? I can start.
Yeah, go ahead.
I think for someone like you, what I said applies. So certainly don't do any more reading at all on hematology or oncology. You've done 4 years, so you should know everything to be able to answer the questions and get a high mark. So what you need to do is focus on everything else. What may be good for you is if you can do some kind of modular scheme where you get the learning again. It's often, rather than spend ages reading something like Kumar and Clark, if someone tells you listen to lectures, then that's actually easier for you to do, and you can make a few notes and you can listen to the lecture again and again. And if you're seeing things and you're hearing things, that's often a little bit better in terms of memory. Whereas if you're reading a book, it's only one dimension where you're taking things in. So in terms of taking it in, it's less, you're taking less information. So maybe listening to a modular course will be quite helpful. You probably need to focus on the basic sciences. So those clinical sciences, those 25 marks, because although there's some overlap with oncology, hematology. So certainly the immunology section, perhaps you may be very good at, but all the others you need to really, really focus on. And then it's all the other stuff that you probably don't practice on a daily basis. I suspect you do have some respiratory in terms of pleural effusions and things like that. There may not be as much cardiology. There may not be as much gastroenterology or geriatrics. So focus on those other specialities more so, and 100%. What you may want to do is you may want to do even more oncology and hematology, but you've already told us that you've scored very highly on that. So don't make the mistake of focusing on that. Focus on basic sciences, clinical sciences, and try and do the other ones. Try and figure out what your weak topics are and focus on those first.
Yeah, I completely agree. And I think, I mean, preparing yourself for this exam after, having done some sort of a specialist work over the years is challenging. I mean, it's not easy. But the breakdown of questions that we showed that Robin had shown in the earlier slide, that's also quite important, because then you can also try and say that this is the amount of time that I can dedicate to each topic. And doing the questions first as an MRC, like a MCQ. And then, obviously, if you get the answer wrong, then looking at the theoretical aspect of it and just reading around that topic in particular can actually help you build your knowledge and get you ready for the exam. So rather than reading pages and pages of, say, I wouldn't mention Command Clark again, but Philip Calder's book, maybe, it doesn't help. But if you can just read do the question, and if you say that, okay, fine, this one is wrong. Why did I get it wrong? Let's look at the books and read the knowledge around it. Then slowly you will build up that, theoretical knowledge to get ready for the exam. But focus on other topics. Yeah, absolutely.
Thank you so much.
I think there is one more question, I think on a similar line. I think Dr. Kuldeep Devre, he has asked, do you suggest reading a Davidson? I think probably it's the same line.
I mean, Davidson is similar to Kumar and Clark.
Yeah.
They're quite similar. It's up to you. As Nawad said, if there's a particular area that you're doing really badly on, then doing MCQs may not be. Go back to the book and read on that topic. So it kind of re-emphasizes your knowledge in that topic, and then go back to the MCQs. And that way, a book like Davidson or Kumar and Clark may very well be helpful.
Yeah, I mean, I think that brings, this is something that I was going to say earlier as well. For me, I mean, I used to be a very there are some people who are very perfectionists, and they want to read as much detail about, a condition or a problem. And for that, I can understand why people rely on things like, reading Harrison or reading Davidson or Command and Clark, because they have the detail in it. But I think for this exam, you don't need too much of detail, okay? What we are trying to say is that MCQs will have, some MCQs, they will have explanation why this answer is correct. And that is the only amount of detail that you need. So you don't need to get into absolutely, the detailed description of the condition and how it is, the pathophysiology of it, etc. Just read the bit that is important for the exam, okay? So this is a test of your knowledge, okay? And there are specific questions that will be asked, and you just need to know the specific details. So reading Harrison or more bigger books, where there is a lot of description of a condition, is not going to be helpful. I think you're just going to use up all your time. In that time, I would suggest just revising with the MCQs and reading around the topic that is just about essential for that purpose.
Right. Thank you both. I think thank you, Dr. Robin and Dr. Naved Ahmed, for discussing and giving all the tips and tricks for the candidates. I think
if I can interrupt, I have one small question.
Yeah, please carry on.
Yeah. So I am the pulmonologist who have been practicing since 10 years. Good practice, but the main intent of me taking MRCP is to eventually look for opportunities in UK and settle down there later. So in this regard, so I consider myself as a naive person to take up MRCP now, because having lost touch in basic sciences for a long time and not having good hold on the other internal medicine subspecialties. So in this regard, will Farz Academy modular course alone will suffice? So because I'll be able to spare only at the max 3 hours per day for preparation, considering that.
I mean, we have a conflict of interest here, but I think, yes, so Dr. Devre, I'm saying we have a conflict of interest here, but I think I will say yes to that, that the Farz Academy course will be quite, the modular course particularly, and I'm one of the faculty members, as Robin is. We have designed the course in a way so that you don't have to spend too much time on your books, and that the information you get from that course is enough for you to have, to take your exams. So from my purpose, yes, I think, the app as with the, bank of questions and the modular course itself should suffice if you have less time in your day.
What you need to do, and I completely agree with that, what you need to do is use different ways of learning. So, the modular course itself is never enough. And the reason is that if you do, and it's always the MCQs are right at the top in terms of, you know, your chances of passing. Because number one, it helps you with knowledge. And number two, it helps you with exam technique, because you're kind of reproducing exactly what you're going to do in the exam. And there are little things that you can ask in an MCQ, which you won't necessarily find in a book, or you won't get on a course, because it may be a minutiae. But there are certain things that crop up in the exam again and again and again. And so we will try and highlight those issues also. And there are a few nuances in the MRCP in that regard, which again, you may not get in a book or a modular course, which is why the MCQs are so important to again and again and again.